What's up, y'all? It's Karel the Girl Miniature. Miniature, y'all, and I am here with another collab, another Hapi collab with other creators, like 15 other creators. But our collab is on Juneteenth, and my portion of the collab was I decided to do it on like how young people are using social media for social justice and to raise your awareness of what's been going on in our community and different things. So the first how my film is going to take place is my first thing is going to be how pain treatment is not fair for black people, how they it's an injustice in the pain treatment, and how they think that black people don't feel pain the same way that white people feel pain. My second thing is going to be on the racial biases of how the coronavirus, they have that little machine that they put your finger in, or they'll show it, I'll show you on the film though, and how the pulse, it's called a pulse respirator, and you put your finger in it, and how it shows, he's going to tell you how the pulse is done totally, how it reads totally different for black people. The third thing is going to be about how Elvis stole black music and the dances from black people, and that's also how this new Chinese group is doing the same thing. They're taking the Soul Train dances and music and changing it to their self, and the people are just going, yay, yay. Also, the fourth thing is going to be how black fathers, they always said there is no black fathers in the household, and how that's a total myth. The fifth thing is going to be on how this supposed to be a great gynecologist doctor did all these operations on black women without any anesthesia, and then so they finally found out that you need anesthesia, and then they started doing it on white women once they gave them anesthesia for their surgeries. The other thing I'm going to do it on is how there was a first group of ambulance people were black men. The seventh thing is going to be on a black surgeon, lady surgeon. And the eighth thing is going to be on, he just said a little bit about Juneteenth and about the black woman that I did. I did a video on Creamalicious ice cream, and he's going to touch on that a little bit. So I hope you like it. Like in our household also, they're doing so much with race now. Like Netflix, for instance, every movie there's a black mother and a white father, or vice versa. There's never two black parents. Very rarely are there two black parents. In my household, there are black people, all black people. So little by little, they're trying to get you used to seeing this and making this the new norm, which is not. And so in my household, we cut it off. Anytime we see two different cultures, we cut it off. But you're not going to normalize something like that in my household. So you have to just notice the little things that they're starting to do to change your mind and get you used to it, so it's not going to take place. There's also a film where they got a new ad commercial in there that it's a white woman with 3 black boys. I don't know where that's going to take place at, but not in my household. So just look at the little things. You have to start being aware of the little things and little ways that they're tweaking things to make it normalized for you. And it's not going to be normalized in my household. And I feel that if a lot of people start cutting the TV off, or not giving your views, or changing it, or even writing on it, then it'll change. Okay, so I hope you enjoyed my film. This is Karel the Girl Miniature. Thank you.
Understanding racial bias in medicine can save lives. In 2016, a study at the University of Virginia showed how racial bias impacts pain treatment. The study tested false beliefs about biological differences by asking health professionals questions like, are black people's skin thicker than white people's skin? Here's the crazy thing. 50% of the surveyed medical students and medical residents endorsed at least one of these false beliefs. Those that endorsed false beliefs rated the pain of a black versus white patient as lower and were less accurate in their overall recommendations for treatment. Understanding racial bias in medicine can save lives. 2016, a study at the University of Virginia showed how racial... What does racial bias in medicine look like?
Joel Burvell is an aspiring physician, and he's well on his way. The 2017 Yale University graduate is now a medical school student at Washington State University's Elson S. Floyd College of Medicine. Burvell says he's a radically honest person, so he says it is an absolute truth that there is racial bias in medicine.
I think I have an ability, and I've been blessed with a lot to be able to be in a position where I can now look at both sides from the medical community and from the Black community and try and kind of remedy those rifts that have been created.
Burvell has started using his Instagram page as a way to bring attention to the disparities.
In 2016, a study at the University of Virginia showed how racial bias impacts pain treatment.
The medical community spends millions of dollars every year to conduct studies and testing and buy life-saving, medically advanced devices. But Burvell says the problem is diversity is not always a consideration, and that's a problem that's become too big to ignore.
When these things are going through testing, it needs to be done on a diverse community. It can't be done on one single population, on a white population or an Asian population or only Black population. It has to be done with everyone in mind and making sure that everyone is tested.
Burvell points to the ongoing COVID crisis as an example.
This is a pulse oximeter. It measures your blood oxygen saturation level and also helps guide medical decision making. But studies have shown that it doesn't treat all skin color equally.
Two of the CDC criteria for diagnosing COVID is shortness of breath and low oxygen levels. The pulse oximeter is typically used to measure both.
Because of differences in how the skin absorbs light, Black patients are more than 3 times as likely to have inaccurate, overestimated oxygen saturation levels compared to white patients.
And that inaccuracy could leave some Black COVID patients in far worse condition and on ventilators, unable to breathe on their own.
And a lot of my medical school friends from around the country started responding to it saying, I had no idea. And then a lot of physicians that follow me started saying, I had no idea. And that was what really surprised me, that physicians and people in the healthcare field actually don't know about this.
He says doctors are human, so they will miss things, which is why you have to be your own biggest advocate and fight for the healthcare you deserve. Burvell says he will keep posting and keep fighting for the rights of patients to know, especially Black patients.
By appropriating Black culture. Ads for this new Elvis movie have been everywhere, so I want to talk about it. So Encyclopedia Britannica literally says a member of a majority group profiting financially or socially from the culture of a minority group is cultural appropriation. And it's very well documented that Elvis's flagship music and dance styles came from Black American culture. Many of his breakout hits were covers of songs originally by Black artists whose race made them undesirable in the industry. And you can see his swing was copied from Black performers who had been looked down upon for centuries. And Elvis' success was only possible because of a racially charged effort by his management, the press, and audiences to overlook or outright shun more talented Black performers in an effort to make Elvis the next big thing because he was a part of this majority group. Sam Phillips, who some call the man who created Elvis, was literally quoted saying, "If I could find a white man with a Negro sound and a Negro feel, I can make $1 billion." And sure, all musicians take inspiration from elsewhere, and that's fine, but there's a difference between that and only being famous because you can do an okay performance of Black culture as a non-Black person. That was Elvis's entire shtick, that's what made him famous, and that's what earned him the title of the King of Rock and Roll. And this whitewashing of history results in the international fan bases of artists like Elvis, the Beatles, and other white legends having no idea that these artists harvested everything that propelled their success from Black American culture. The question then becomes, will the movie take an appropriately critical approach to highlight this dynamic? I wouldn't bet my money on it, but I'm not going to pass judgment on something I haven't seen. But comment your thoughts, share this video, and follow for more. Did Elvis Presley... Happy Father's Day, everyone, especially to the Black community. And on that note, I just want to remind everyone of a few things. Number one, the absent Black father narrative is a stereotype. Most Black fathers do live with their kids, and the CDC found that Black fathers living with their kids are the most involved out of all racial groups. Number two, that stereotype comes from media depictions and misinterpretations of data about children being born outside of wedlock. But just because someone is born outside of wedlock or doesn't live with both parents doesn't mean that either parent is neglectful. And on marriage, a social psychology study showed that Black people value marriage at the same rates as other groups, but are impeded due to educational and economic deprivation in their environment. And three, ending the system of mass incarceration, providing sexual health resources, and supporting educational access will be more effective at fostering responsible Black fathers than scolding teenagers. There's a more comprehensive video about this on my page if you want to dig deeper. Sources are in the comment.
Gynecology, For too long, 19th century physicians like Dr. James Marion Sims have been considered the fathers of modern gynecology. But it's actually the invisible enslaved women and children who were experimented on by Dr. Sims who are the true pioneers. 3 of these women's names are known: Anarcha Westcott, Lucy Zimmerman, and Betsy Harris. Anarcha was only 17 when she endured 30 painful and unsuccessful surgeries. Doctors held the belief that black people, especially black women, did not feel pain, a racist belief that permeates in medicine today.
Let's talk about Freedom House, the first mobile emergency medical service that became a national model. In the 1960s, Pittsburgh was segregated by race, and ambulance services were privatized. At that time, police used to respond to medical calls. They would pick you up, throw you in the back of the paddy wagons, and rush you to the hospital. But they were slow to respond in black communities. The Freedom House was started in 1966. It was staffed by young black men from inner city Pittsburgh who were otherwise unemployable. The program took these people and retrained them to be paramedics in their communities. In the first year, they responded to more than 5,000 calls and transported over 4,000 patients. What made Freedom House effective was their compassion and connection to their community, but they faced racism from hospital staff, patients, and even the city government. Freedom House became a national model, but after just 8 years they closed, and many of the black paramedics were excluded from working in the new system. First black female neurosurgeon. Let's talk about Dr. Alexa Kennedy. She's truly mind-blowing. Dr. Kennedy was a surgical intern at Yale New Haven Hospital in 1975, becoming the first black person and first woman to ever be in the program. But it wasn't so easy. In college, she almost dropped out as a mathematics major. She said the greatest challenge she faced becoming a neurosurgeon was believing it was possible. Dr. Kennedy also has a U.S. patent for the anti-siphon shunt, which takes off excess fluid in the brain. Today, she continues to be an advocate for diversity, but let's listen to her own words of encouragement.
I think you have to not let other people define you. You have to know yourself and understand their problem versus your problem. So you can't give yourself your sense of self-worth to somebody else.
It's the Freedom for Me plates, or their infamous Juneteenth ice cream. As horrifying as those were, there was a very slight silver lining. And that's the fact that after the backlash, this brand went viral. This is Creamalicious Ice Cream, which is a black American-owned artisan ice cream brand founded by Chef Liz Rogers. People accused Walmart of taking the flavor red velvet cheesecake from her, and I'm sure Creamalicious does it a lot better, and they also have other flavors like Slap Yo Mama Banana Pudding, Thick as Thieves Pecan Pie, and Porch Light Peach Cobbler. And I promise this really isn't an ad, but I just saw those flavors and how good they looked and had to make this video and share a quick reminder that for almost every consumer product that exists, there's probably a black American-owned version of it, and you should support them, especially this month. Follow for more. Do you all